Preoperative care in AV fistula. Explain full procedure and aftercare. Let the patient talk to someone who has a well-established fistula. Fashion should be well hydrated before the surgery. Part preparation. Hemodialysis procedure. In hemodialysis, the client toxin-laden blood is diverted into a dialysis, cleaned and then returned to the client. While the blood is in the dialyser, a mechanical proportioning pump causes dialysis fluid to flow on the other side of the membrane. Toxins diffuse across the membrane from the blood to the dialysate. Strict asepsis must be maintained throughout the procedure. One of the vital aspects of hemodialysis is the establishment and maintenance of adequate blood access. Without it, hemodialysis cannot be done. The major routes of access are central venous catheter for short-term access and internal arteriovenous fistula and grafts from. For chronic dialysis, central venous catheters. For hemodialysis are large-bore, double-lumen catheters that are inserted percutaneously into the jugular, femoral, or subclavian vein. They are used when immediate access to the bloodstream is needed. These access sites can be easily placed at the bedside and used immediately after placement is confirmed by X-ray. Longer-term catheters that are tunneled and cuffed are used if temporary access is required for longer than 3 weeks. Unfortunately, they are easily infected and are associated with the high incidence of venous stenosis. Strict aseptic technique must be used during insertion, and dressing changes are usually performed by a limited number of trained nurses. Subclavian vein placement is the least preferred because of the risk of pneumothorax. Surgery is done to place 2 rubber-like silicone, silastic cannula into the forearm or leg. The 2 canals are connected to form a U-shaped. Blood flows from the client's artery through the shunt into the veins. This access can be created quickly and thus is particularly suitable when dialysis must be started immediately. However, infection at the site of insertion and clotting are complications that after necessity. Removal. Blood flow rate 300 to 500 ml/mi. Dialysate 500-800 ml/min. Usually done 3 times a week, and each dialysis lasts for 4 hours. Or in hemodialysis, the patient's blood is pumped through the blood compartment of a dialyser, exposing it to a partially permeable membrane. The dialyzer is composed of thousands of tiny synthetic hollow fibers. The firewall acts as the semi-permeable membrane. Blood flows through the fibers, dialysis solution flows around the outside of the fibers, and water and wastes move between these 2 solutions. The cleansed blood is then returned through the circuit back to the body. Ultrafiltration occurs by increasing the hydrostatic pressure across the dialyzer membrane. This usually is done by applying a negative pressure to the dialysate compartment of the dialyser. This pressure gradient causes water and dissolved solutes to move from blood to dialysate, and allows the removal of several liters of excess fluid during a typical 3-5 hour treatment. For example, if the plasma potassium concentration of the patient is above normal, potassium diffuses out of the blood across the tubing and into the dialysis fluid. Similarly, waste products and excess of other substances also diffuse into the dialysis fluid. This type of hemodialysis is usually called nocturnal daily hemodialysis, which has shown a significant improvement in both small and large molecular weight clearance and decreased the requirement by taking phosphate binders. Postoperative care in AV fistula. Limb should be kept warm and well supported to maintain the peripheral circulation. Monitor the blood pressure and maintain at 100 systolic minimum to reduce the risk of fistula thrombosis. Avoid antihypertensive therapy. Examine the wound site for bleeding or swelling. Check blood flow regularly. Brute/thrill. Regularly avoid using fistula arms for carrying heavy loads. Avoid tight and restrictive clothing on the arm. Hand exercises promote fistula maturation. Arm should not be used for phlebotomy, cannulas, or for recording the blood pressure. Notify physician if any bleeding. Long-term care. Keep the access clean at all times. Be careful not to bump the access. Do not wear jewelry over the access. Do not sleep with the access under the head or body. Check the pulse in patient's access every day.